Welcome back. Created to raise awareness about the importance of routine screenings in the Hispanic community, MSKCC created the Get Checked A Tiempo campaign. The initiative aims to shift the conversation around cancer from one of fear and stigma to one of empowerment and proactive health management. Let's take a look at one of the PSAs created for this campaign.
I may not always love you, but as long as there are stars above you, you'll never need to doubt it. I'll make you so sure about it. God only knows what I'd be without you.
I'm too late.
Breast Medical Oncologist for MSKCC, Dr. Pamela Drullinsky, joins me to discuss. Doctor, thank you so much for joining me.
Thank you so much for having me.
One, I just want to say, this is such an important discussion that we're about to have because I understand, it's talking about a vulnerable community. Can you tell us a little bit more about the work before we talk about the campaign, the work that you're doing? I understand that you're also a director in this as well. Can you tell us a little bit more about that?
Yeah. So the Ralph Lauren Foundation has been around Harlem for about over 20 years now. But Memorial Sloan Kettering Cancer Center partnered with the Ralph Lauren Foundation over 5 years ago to really improve cancer care in Harlem and the South Bronx community. And I'm so glad to be here so that we can spread the word.
That's amazing. Now, I want to talk about Get Checked A Tiempo campaign. Can you tell us the primary goal of this campaign and how it began?
Yeah. So Get Checked A tiempo means on time, and right away. So we really want to encourage women to get their breast cancer screening. Breast cancer screening is very important. The earlier we pick up breast cancer, the more curable it is, and mammograms are recommended for women beginning age 40. And unfortunately, so many of us are not going to get their mammograms.
Now, how does the campaign address the unique challenges the Hispanic community faces regarding health screenings? Because I definitely want to emphasize that, there's an effort to reach the Hispanic community. So, what are some of the challenges this community faces?
Yeah. So I think there's a lot of fear for women. We hide breast masses. I can tell you as a medical oncologist over 30 years at Memorial, lately we've been seeing more and more stage 4 patients, and women are just not bringing that to attention. So there's fear, there's misinformation. Even with insurance, only about 70% of women are getting their mammograms, and without insurance, the numbers go down to 40%. So one of the things I wanted to mention is that with MSK RLC in Harlem, there is a fantastic program from New York State. It's called the CSP, the Cancer Services Program, where women can get mammograms for free. And you don't even need insurance. You can come in without a prescription, without insurance, and if you qualify, you can see a nurse practitioner and get your mammogram same day.
That's amazing. And then I understand that you, can you also translate that message to our Hispanic viewers so they can understand? Because I think that's very important information.
Okay. Thank you. I definitely want to say it in Spanish. So, lo que quería decir es que sin seguro uno puede tener una mamografía en Memorial Sloan Kettering RLC, que está localizado en la 124 con Madison. Y si tú tienes una masa o un problema, nosotros nos podemos ver sin seguro y sin ver un médico.
Thank you so much for that. Now, how can we use this campaign to change the narrative from fear to one of empowerment?
So I think we need to get the message out that breast cancer is highly, highly curable. Just repeating that it's over 90% curable when picked up in stage 1 or stage 0, which is pre-cancer. So there's no reason for us to neglect ourselves. The other thing is that women fear the pain of mammograms, but it's really only for a few seconds that it's uncomfortable. So there's no reason not to get a mammogram.
Now, what specific barriers could be facing the Hispanic community that may lead to this delay or avoidance of routine screenings?
Yeah, I think part of it is there could be a language barrier. Luckily, in New York, we have most things in English and Spanish. Also, most facilities have Spanish speakers. If not, we have interpreters. And I think also lack of insurance. So I just want to stress that New York State has wonderful services for people without insurance.
Now, how can community leaders and healthcare providers collaborate to improve access to routine screenings for Hispanic populations?
So I think one of this is this program and the awareness. I think the October Breast Cancer Awareness is extremely important, and Memorial Sloan Kettering is right here in Harlem and the South Bronx to help this community and spread the word.
Now, what role does education play in the Get Checked A Tiempo campaign?
Yes. So I think that unfortunately with the pandemic and the internet, there's been a lot of misinformation, which we're trying to break those barriers. Cancer is very, very scary, and a lot of times people fear the medication more than the diagnosis. So we're trying to say that there's so many treatments available, there's no reason not to see a physician.
And I also want to talk about the importance of representation. I know we talk about it in other areas, but can you talk about how being represented in the doctor's room, having somebody there who understands you or can advocate for you, can be very helpful?
Yeah. So, luckily a lot of women are in medicine now, including myself. And so I think gynecologists, internists, women shouldn't be afraid to speak to their practitioners. And as a woman, my family is from Chile. There's a lot of us who do speak Spanish and understand the Hispanic community. And we just come and see a physician, see a nurse practitioner, and we can help you. So don't ignore your symptoms.
Now, what are some ways that, not only the patient, but, everyone, our entire society can kind of step away and understand that there is a stigma, and what can we do to kind of end that stigma surrounding not only just cancer, but any, sickness?
Yeah, no, I think it's a great question. And I think, again, going back to the misinformation, I think science is people don't value it as much as before. And I think we need to begin to trust our professionals who studied, who work in this, and seek help. And I think, especially with breast cancer, as an oncologist, I don't even understand it. Women are just embarrassed to bring up a mass or a symptom, and we're just not reaching out enough. So I'm glad that we're doing this, and hopefully we're reaching more women.
Now, how can we use social media to effectively spread, the message of Get Checked A Tiempo, and kind of use it as a tool to kind of combat misinformation, but also get to people a lot quicker?
Yeah. I think BronxNet is a great idea because a lot of patients and people in general are getting information through YouTube and other channels. Also Instagram and Facebook. I don't even know how many people watch the news anymore. So I think, the highest number of women are getting diagnosed in their 50s and 60s. But you also can be diagnosed before the age of 40. So hopefully with all this, again, the social media that there is now, there is a way to get the message out. And I think this program is super helpful.
Now, when should people begin thinking about their body in this way? As you mentioned, it could happen before 40. So what age do you encourage, women to look at their bodies and start maybe noticing some signs or symptoms?
I think what we say before the age of 40 is to be aware of your breasts. Especially if you have a mass, you shouldn't ignore it. Some of it is just an abscess, a cyst, or something like that, but I would bring it up to your internist, your primary care physician, family physician, gynecologist. Also very important is Memorial Sloan Kettering has a RISE program. It's for high-risk women. So for example, you really need to be aware of your family history. So if your mom or first cousin or sister had breast cancer young, you might qualify for a high-risk program where you can get genetic testing, mammo, ultrasound, MRI, all before age 40. So that's another message to know your family history and seek help.
Now, where can people go to learn more information?
So Memorial's website, mskcc.org. You can also look at the website for MSK Ralph Lauren Center.
And can you translate that in Spanish for our Spanish-speaking viewers?
Yes, thank you. So para más información pueden ir a mskcc.org o la website de Memorial Sloan Kettering Ralph Lauren Center.
All right, well, Doctor, thank you so much for joining us and having this very important discussion for our community.
Thank you so much for having me.
To learn more about this campaign, please visit the website getcheckedatiempo.com. Stay tuned, we have more for you right after this.